Nurses endure. Utah nurse is arrested for refusing a blood jar request. What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably not going to change. Nurses endure. A Utah nurse is arrested on the job, taken away in handcuffs because she refused a blood draw request from a police officer in an emergency department in Utah. Welcome, everybody. This is going to be a Facebook Live video recording of my thoughts on the recent incident that happened in Utah. This has been a very polarizing subject. For those of you who have no idea what I'm talking about, take 5 minutes to go ahead and Google Utah nurse arrested, and trust me, the internet magic will do the rest. Had a lot of fans across my social media accounts requesting to hear my thoughts, as well as probably wanting a little bit of an outlet to discuss with others their feelings on this particular incident. And it has become, the internet has been swelling a little bit over this particular incident. So we're going to go and review the incident that happened. I'm going to give you as many facts, opinions, and interpretations as I have gathered over the past several days. And then we're going to, maybe have a bit of a discussion. Once again, this is a Facebook Live recording that I'm going to post on all of my social media accounts. So if you don't catch this live and you're catching this on the record, welcome back. And hopefully you'll stick around for the entire recording. Listen to my thoughts, and I will do my best to share what the live audience is feeling. I'm going to take a second here to welcome all of my live viewers. We have James and Tammy, Dr. Mike, who is the nurse champion, my favorite nurse champion, and my good friend. We have Veronica, hello from Ohio. Dee, as well as my friend Drew, Esmeralda, and Christine, and people are just rolling in. Y'all are quite interested about this subject. I have made a lot of notes, so we're going to jump right into this. By the way, at the end of this recording, I'm going to include a boatload of links that I have acquired over the past several days about this particular topic. My good friend Dr. Mike has, in the Facebook Live feed, has already included a link. So for those of you who have no idea what we're about to discuss, I would highly recommend you taking 5 minutes, maybe opening up a second tab, and take a quick listen and read all about this particular incident. Very polarizing. I already have quite a number of people in the live feed who are already tapping away, so we're going to jump right into this. Once again, welcome to everybody into the live feed. We're going to be talking about the quote-unquote Utah nurse incident. There's been a lot of hashtags out there, everything from We Stand With Alex to Stamp the Violence to Silent No More. There's been a number of social media sites and very prolific social media influencers who have already posted numerous posts as well as responses and video responses to this very emotionally challenging incident. I am going to do my best, my very best, to maintain some professionalism as well as try and maintain some neutrality so that we can have a reasonable discussion about this. I, like many of my fans, many of the tribe members out there, I had an immediate knee-jerk response that was probably a bit violent and a bit out of control after what I read and what I saw on the internet. So let's get right down to business. What I know, what I've read, what I've watched so far. Now, the timeline is a little shady or a little confusing because I'm not exactly sure how long ago the incident actually happened. I think this incident happened weeks ago. In fact, it might have happened in July at some point. But the video wasn't released until the very end week of August. And there's speculating facts and figures and opinions out there as to who released what first and who released and why they released what information they did release. What did get released was multiple videos. There were videos that documented the incident. There were videos from fellow staff members within the emergency department. There were body cams that were released later to the public, body cams by the officer that is involved, as well as the officer colleagues and fellow officers who were in the emergency department at the time of the incident. And here's what we know, or what I should say, what I've interpreted, is that there is a nurse by the name of Alex Wubbels, W-E-B-B-E-L-S, who was working in an emergency department in Utah, I think University of Utah. Someone said she was in a burn unit. I don't know how accurate that is, but she was in an emergency department of some sort. Some say she was in an ICU. I really don't know, to tell you the truth, and I haven't dug deep enough to, quite honestly, to determine that fact, and I don't really think it matters. Whether it was in the emergency department or if it was in the ICU, it happened in the hospital, it happened on the floor, and it happened between a nurse who was on staff caring for a patient and a police officer. It seems that this particular patient was part of a motor vehicle accident. Once again, this is just interpretation for what I'm reading. I don't know if they were the driver or the victim. Once again, it should not matter. They are a patient in the hospital, period. And there's time frame differences, but the police officer in question by the name of Officer Jeff Payne, P-A-Y-N-E. Once again, all this information is readily available on the internet. I am breaking no laws. I am breaking no HIPAA privacy laws. Officer Payne went to the hospital, emergency department, whatever, nursing unit where Nurse Alex was working, and he is part of the blood draw program. I did not know this. I learned a lot of information because of this particular public incident. He is part of a police blood draw task force program. Apparently there are actual police officers who are either licensed phlebotomists, become certified in phlebotomy, or become certified in drawing blood, who went to this particular place, once again, don't know if it was an ED or an ICU, and requested blood from this particular patient. And the way I'm interpreting it is that there's two versions here, that we draw blood from our patients to medically treat the patient, to resuscitate, to provide care to them. And then there's an entire different set of blood draws that are performed by the police force, or these phlebotomists, these police officers. They actually bring their own kits. They actually, I don't know if they actually they can perform the blood draw, of course, but they usually bring their own kit. They bring their own blood vials. They label all their stuff, and they request blood samples from patients that they're needing blood from for one reason or another, and we'll get to that in a second. So this particular patient was part of an accident of some sort, and I don't know if the accident happened relatively the same time that the police officer and his colleagues, fellow officers, showed up on the unit to draw blood from this patient. So what I mean by that is, did the accident happen the same day that the police officer was asking for the blood draw request? Or did it happen days later or even weeks later? That is a little shady, and the facts are conflicting. Regardless, the police officer went to this unit and said that they needed blood from this particular patient. And Nurse Alex, once again, Alex Wubbels, asked for proof, or asked for the legal documentation that proved that the police officer had the legal right to draw blood from this patient. This is information that was new to me. I never knew this. But apparently you, at least in the state of Utah, and I'm assuming in other states, you are not allowed to draw blood from an unconscious patient because they are not providing you with consent. Informed consent is no longer a valid and active law. And I went under the assumption that informed consent would be given in the case of a patient who is part of a trauma, part of an accident, part of an ongoing investigation of some sort. And that when the police need the blood, that the patient is giving informed consent. That is not the case. Apparently, in the state of Utah, informed consent is no longer in effect. In fact, it's a law that is almost 10 years old, a decade old. So informed consent is not applicable. The only time that a nurse, or the only time that a police officer can request blood from a patient is in 3 separate instances. And this was very interesting to me. The first instance is the patient consents and says, yes, by all means, go ahead, take my blood. That's the easiest one to understand. Police want your blood. Patient says, by all means, go ahead and take my blood. The second one is that there has to be a warrant out for their arrest. So if they are not conscious, if they're not conscious, they can't give there's no such thing as informed consent. So they can't say to the police officer, please, you're allowed to take my blood. I give you consent. So the only other 2 instances where a police officer can take a patient's blood who is unconscious is if they are under arrest, which this patient was not, or if there is a warrant out for their arrest, which this patient was not. And I don't have the legal education and background to go into the specifics, but the only other instance that I think was applicable, meaning that the police officer showed up, wanted blood, he was unconscious, and there's no warrant for their arrest, and they're not under arrest, if the police officer or the police force felt that there was probable cause, then they could enable an emergent warrant or emergent warrant for their arrest, and then they could have easily drew the blood. So it's clear now that during the video coverage that is all over the internet, that this police officer stated, or the police officer supervisor stated, that they did not have probable cause to arrest the patient in question. So they did not meet any of the 3 requirements. The patient didn't consent because they weren't awake and couldn't say it. The patient was not under arrest, and the patient did not have a warrant out for their arrest. So the policies and procedures of that hospital that Nurse Alex works in University of Utah, this is going under my assumption, the policy states that if they have not met those 3 requirements, that the police officer cannot take the patient's blood. So this is where things get a little bit heated, is that apparently this interaction between Nurse Alex and the police officer goes on for 10 minutes or more. There's a video out there that's 18 minutes long, so I think it's the body cam of at least one of the officers, if not Officer Payne. And the body cam documents how the police officer does not have valid proof, does not have valid documentation to draw the blood from this unconscious patient. There's verbal interaction between Nurse Alex and Officer Payne over an extended period of time. It gets so heated that I believe Officer Payne is radioing his supervisor backwards and forwards with the conversation between him and Nurse Alex. And then Nurse Alex made several phone calls to several nursing supervisors and nursing administrators. In fact, there was a nursing supervisor present, standing in the video. I think he had on all white. He was standing in the video with Nurse Alex and the officers, including Officer Payne. And the verbal tirade that goes on is that Nurse Alex once again states out loud numerous times that you do not have the legal right to take this patient's blood. And the argument continues. Then Nurse Alex puts one of the administrators on the phone. Now this is 10, 12 minutes into it, and I'm rounding it up once again. I'm rounding it up. There was a heated conversation between Nurse Alex and the officer. Nurse Alex puts her administrator, she has her cell phone. In the video you can see she's holding her cell phone. She puts her cell phone on speaker, and she's talking to the administrator and talking to the officer. So there's like a three-way conversation, and the officer is radioing his supervisor. So there's almost 4 people in the conversation. 2 physically present, 1 on a radio, 1 on a speakerphone. And when Nurse Alex states again that they do not have the legal right to take this patient's blood, she actually has the piece of paper that is the contract between the local police department and the hospital that Nurse Alex is employed by. So where they are physically standing, she's holding the contract that they have between the hospital that the patient is physically in and the police department who Officer Payne works for. So there's a binding contract that states that no police officer can take patient's blood who is not consenting. So he's unconscious, he's not consenting, and there's no warrant out for their arrest, and he or she is not currently under arrest. I don't know if the patient was a he or she. I did not care to find that out. It should not matter. So then the Nurse Alex's supervisor administrator says through the speakerphone, why is he arguing with you, or why are they causing such a ruckus? I'm paraphrasing. And Nurse Alex is once again advocating for her patient and simply saying that you don't have the right documentation to take my patient's blood, to take the patient's blood. And the supervisor that is on the speakerphone says to the Officer Payne, "Sir, why are you threatening the nurse?" I don't exactly remember the words. You can view the video yourself. But after the supervisor on the speakerphone says, you're going to regret threatening a nurse, within an instant or within 2 seconds, Officer Payne changes his demeanor completely and says, "Okay, that's it. You're under arrest," and starts to what's the term I want to use? Starts to grab for Nurse Alex. Drew saying the nursing supervisor says over the speakerphone, "You are making a big mistake by threatening a nurse." And there is a 1 to 2 second pause, once again paraphrasing, and Officer Payne lunges into Nurse Alex and says, "That's it, we're done, you're under arrest." And then Nurse Alex, I don't want to say runs away, but starts to walk in the other direction. And the cameras follow the interaction, and then it becomes a wrestling match between a police officer and a nurse on duty. Nurse Alex is screaming at the top of her lungs that she did nothing wrong, that she didn't break the law, and that she's screaming for help. She's actually screaming out loud, "Please help me, somebody help me." It's the interaction between Officer Payne and Nurse Alex. It goes from one area of the unit, once again, ED, ICU, I don't know, and it goes out the doors. I'm going to guess it's the emergency department because it exits the building. So it goes from inside the hospital and it exits. It exits outside of the hospital. And you can see Nurse Alex being detained. I'm using the word detained. Being detained and physically subdued and arrested right there in her place of work. Her arms behind her back. He latches the cuffs on her. The nursing supervisor, who's dressed in all white, is present there. He's manhandled her. He's subdued her with force, with physical force, because he's a much larger, taller man. And she's pressed up against a brick wall. It looked like a brick wall. She's screaming for help. The nursing supervisor in all white says that the administrators are on the way, that my supervisor's on the way, and Officer Payne says, then fine, she can wait in the car until everybody gets here. And, you know, a couple things happen, and you can see that Nurse Alex has her hands cuffed behind her back. He puts her into the police vehicle with her hands behind her back, and then puts the seatbelt on. And then, you know, he goes about doing whatever he does, and then the video kind of cuts off. Those are the facts of the video that we see. Verbal altercation and disagreement. The police officer lunges into the nurse, chases the nurse out the doors of the hospital, physically subdues her, forces her against the wall, cuffs her, puts her in the police vehicle. Some additional information that I find relevant is that Nurse Alex apparently called numerous supervisors to clarify the hospital's policy and procedure, as well as to reiterate that she was simply following protocol. She was simply doing her job. She was not argumentative with the police officer. She was not claiming the police officer was in the wrong. She was simply stating that she could not perform whatever it is he wanted because it was against hospital policy and it was against the contract that had been agreed upon between the hospital system, that particular hospital system, and the police department in that city. We also learn that this is just a sidebar, that Nurse Alex is also a former Olympic athlete of the United States. She apparently was some sort of ski athlete. I don't know exactly what the sport was, but she actually represented the United States on 2 separate occasions in the Winter Olympics. Makes things kind of disturbing. Those are the facts. Here are the questions that I have in regards to that. And once again, I have so many live viewers right now that I can't keep up with everybody. So I want to thank everyone for contributing to the conversation. I will do my best to look back here, but it seems like everyone's kind of agreeing or at least supporting my description of the video, of the pieces, the facts of the video, the information that we all have acquired from the internet. Let me reiterate, I am making nothing up. I am not creating something out of thin air. You can go to Google, you can go to pretty much any of the news websites and you can see these videos for yourselves. There's numerous videos that are kind of spliced. There's some videos that have been spliced together. There's body cam of Officer Payne. There's a body cam of his partner or partners, and then there's a couple mobile video cameras that are getting it from different angles. And here are the questions that I have. The first question I have is, I don't understand, what was the hurry? What was the hurry that the officer needed the blood right then and there at that moment. I don't know, once again, the timeline of accident, admission, and need for blood draw. Did it all happen in the same time frame, meaning the accident happened in the same day? Because the patient was in the ED, so I'm going to go on the assumption that there was a very short time frame. So I think it happened relatively in the same time frame. So that's my first question. What was the hurry? Why did the officer need the blood right then and there? My second question was, why not exercise a little bit of patience and wait for all of the administrators and supervisors to show up? Meaning, wait for Nurse Alex's administrators on the speaker, wait for them to show up. And then the Officer Payne's supervisor that he's radioing, who, by the way, the police officer, Officer Payne's supervisor over his radio told Officer Payne to arrest Nurse Alex if she didn't get the blood draw. So you have to keep in mind that Officer Payne was actually following orders. Not that that excuses his actions in any way, shape, or form, because I asked the question again. What was the hurry? Why in the world was the blood draw needed that moment? Why couldn't it have waited? Even after all of the interaction and verbal disagreement and raising of voices and the differences in opinions, why couldn't it have waited another 10, 30 minutes, 60 minutes? What was the hurry? And I'm reading from my notes again, gang, because this is such a polarized incident that I had to make notes. That's question one. The second question I have is, was there really a need for the use of force? I'm not a police officer. I don't know how to do their job, nor am I going to tell them how to do their job. But I would think, and this is just a general assumption from a public citizen who is also a public servant, I'm a nurse, why was there a need for why was there a need for physical force? Why did you have to chase the nurse out the door, physically subdue her, push her up against a brick wall? Why did you have to cuff her? Was she physically threatening you? Was she physically threatening the police officer? Was she physically threatening to harm anybody within arm's reach, within shout of her voice? Was there anyone that felt threatened by Nurse Alex in some way, shape, or form? There was no reason for physical force. There's no need for force in any way. He could have simply said to her, please don't leave the premises. Supervisor's on the way. It doesn't matter. And it goes without saying that we're questioning his reflexive reaction. A couple people are commenting in the live feed that the officer is also a longtime public servant. He's been an officer for a very long time. And he also has a history with pre-hospital paramedicine. He was an EMT. I think he worked for EMS. And he's also a very decorated officer from what I understand. So as we'll talk about in a minute, we got to give him the benefit of the doubt. The video is very disturbing, but you gotta take a step back and look at it from both sides. I'm not siding with anyone. I am definitely supporting and advocating for my fellow nurse, and that's why we're having this conversation. So my second question is, why use force? Was it really needed? The third thing I want to ask you is, if you were to watch that video and Alex Wubbel wasn't a nurse, how would you feel about the video? What if that interaction, what if it wasn't a nurse? What if it was just another citizen? What if it was, an onlooker? Take your pick. I think we all can see where I'm going with this, is that the use of police force, inappropriate police force, is unfortunately something we're seeing quite often in the public eye because of these body cams. So it's a little disheartening to see it being done to one of our own, which is why this is so polarizing. And lastly, here's the thing that bothers me more than anything, and this is what motivated and prompted me to have this live conversation, is what were the bystanders doing? And the bystanders were fellow police officers, as well as fellow healthcare professionals, fellow hospital employees. What were the bystanders doing? Why weren't the bystanders, why weren't the bystanders stopping the officer from using excessive force? Did they all feel that he was doing the appropriate thing? Did nobody have the red flag go off in the back of their head and go, yeah, this is not right. There's no way, something's wrong here. So those are the things that I want to make sure that we at least recognize. Here's why this is so polarizing. Here's why the internet exploded and this continues to swell in the internet. Is that, unfortunately, the police officer did this to a person who works for the largest workforce in the nation, nurses. And we know what happened the last time somebody decided to mistreat nurses. In fact, it's one of the reasons why you see me as much as you see me in the public eye, is because of what happened in The View. Everybody saw what happened when nurses were mistreated or were not appreciated for what they do. It makes you wonder, I guess it just bothers us as nurses, because this police officer who's supposed to be protecting us, treats another public servant like that. Someone who would probably save the officer's life if he came in with a traumatic injury. And I think that kind of, puts salt in the wounds in a lot of nurses across the nation. The second point I want to make is that he also decided to do this to one of the most trusted professions in the world. In fact, if I'm not mistaken, we are still the most trusted profession in the United States. We've been the most trusted profession for the past 15 years running, except for the year 2001, when the firefighter and EMT was the most trusted profession for obvious reasons during 9/11. We are the most trusted profession for a reason, because we are trustworthy. And Nurse Alex acted in the most trustworthy manner that a nurse could ask, that a human being could ask for. Another reason why this is so volatile and so polarized is that every nurse that viewed that video, the first thing that they thought of is, that could have been me. Because that's what I thought of. That could have been me. You watch that video with that police officer aggressively subduing a nurse, and you think to yourself, that could have been me. That could have been me. In a time where nurses are absolutely paralyzed by the mere fact of violence against our fellow professionals, we turn to the one profession, to the one discipline that is supposed to protect us. It's the one discipline that's supposed to help keep us safe. And it's the profession that physically subdued a nurse for doing her job. So that's why this is so angering. This angers a lot of nurses throughout the nation, because you picture yourself being in Nurse Alex's shoes, and you have to wonder, if you can't trust the police officer to protect you, who can you trust? In a time where we're worried about being assaulted by patients, family members, fellow healthcare professionals, the police are supposed to be the ones who got our back, who help keep us safe, that security blanket. And unfortunately, he's the one that caused this disheartening incident, And I think that's what really upsets us, really hits home, and puts us on the defense. Severely puts us on the defense. So those are the things that I wanted to cover. Those are the things that I wanted to review. Now here are the two take-home messages that I want to give to anyone that is still with me, to all of my live viewers. There's two things that I want you to take away from this unfortunate incident. That I want you to share this with everybody you know. I don't care what your views are. I really don't. I hope that you're supporting Nurse Alex, and I hope that you're supporting her actions. But I want you to share this. Share this with every person you know. They don't have to be in healthcare. They don't have to be a nurse. They don't have to be a police officer. They just have to be a human being. I want you to share this with every human being you know. Share my live video, and I'm going to include a bunch of links once this live recording is over in the description here. A bunch of live links that go into a little bit more detail on the facts that have taken place. So I want you to help advocate for our profession by sharing this. Which leads me into the top two things I want you to take away. First thing is that this job is not easy. Advocating for a patient is hard. If you are a nurse that you're watching this video, can you confidently, with 100% certainty, say that you would do what Alex did? That you would refuse to do something that you were requested from a police officer, from an officer of the law? Would you have the courage? Would you have the gumption? Would you have the strength to stand up to the police? Now, it's easy to say that we can stand up to, patients, and stand up to those mean doctors, and stand up to those aggressive nurses. But would you have, in that moment, would you have had the wherewithal and the strength to stand up for your patient against a police officer? Now, Nurse Alex had facts, figures, and the support of administration on her side because she was in the right in every way. That's the great thing about this video, is there's nothing hazy about this. There's no gray area in any way, shape, or form. Nurse Alex did nothing wrong other than run away from the officer when he tried to arrest her. That is the only thing she is guilty of, is that she was fearing for her physical safety. She did nothing wrong. She did nothing wrong. She did everything right. And that leads me to the last point. Here's my last point, is that I want you to go back and watch this video one more time. I want you to go back and watch all the videos that you can find on Google and all the news sites. And I want you to watch as much video as you can about the actual incident from the body cams and the personal phone videos. And I want you to go find the video where Nurse Alex is interviewed by the local television station, and he asks her questions about the ramifications, and the reporter asks her, flat out asks her, do you think that Officer Payne should be fired? Do you think Officer Payne should lose his job? He asks Nurse Alex some very polarizing questions. And throughout the entire incident, not only during the actual event, but ever since then, when she's been interviewed, anything that she's posted thus far, she has maintained the most respected professionalism that anyone could muster. She has maintained her professionalism in the face of some of the worst adversity you can think of. She is under a microscope right now. Everything that she had done is on camera. There's no hiding what she did. There really is no hiding. And she has maintained a level of professionalism that is unparalleled, that I have not seen in many other professions. And it's amazing that she maintained her composure in the thick of it. When things were getting bad and she was getting blowback and pushback from the police officer and his supervisor and the other officers, I mean, you can imagine how intimidating that was to have. It looked like there was at least 4 police officers there that are telling her she needs to do this, and she refuses because she's advocating for her patient, and she's basically following hospital policy, and she's following the contract to the T. She maintained professionalism the entire time, even though she was meeting severe negativity. She maintained professionalism when she was being subdued. She's physically being subdued. She's being chased. I don't want to say tackled, but she's being grappled, and she's being pushed into a brick wall, and she's being subdued with her hands behind her back. She's screaming for help. She's fearful for her safety. She's screaming for help, and all she does is maintain professionalism. She never swears. She never verbally attacks the police officer. She never verbally attacks anybody at all. She never turns it into a he said, she said argument between the two of them. She doesn't turn it into nurses against police officers. She doesn't lower her standards in any way. She maintains her professionalism the entire time. Even after she's sitting in the vehicle with her hands cuffed behind her back and she's in this uncomfortable position, seat belted in the police vehicle, she maintained her professionalism. Instead of losing her shiz and going postal, kicking, screaming, spitting, yelling, and maybe even swinging at him, because how many of us would be able to hold that? How many of us would be able to maintain that kind of control in the heat of the moment? I don't know if I would have been able to. And I consider myself to have a high level of professionalism. I have a very high level of professionalism, and I'm pretty sure that my ghetto past might have came out. I might have got a little ghetto on that police officer if he would have attacked me. I don't want to say attacked. If he would have aggressively subdued me the way that he subdued Nurse Alex. And then to make things even better, and you got to give Nurse Alex kudos for representing our profession in the highest of standards, because then in the post-interview that was recorded most recently, and once again the timeline is very, scattered. I don't know how long ago this was, but there's a video of an interview with this reporter, and he asks very intrusive questions about what her feelings are. Does she believe that the officer Payne should be fired? She actually answers in the most professional manner, and she says that that's not my decision. How many of you would be able to do that? How many of you would be able to maintain that composure? To be able to say, to be able to bite your lip, bite your tongue until it bleeds, and not say what you truly feel. Because, I don't know Nurse Alex, but I'm pretty sure she would love to just go off on camera and tell everybody how she feels about the incident. how we all probably feel about the incident, about how, there's words like, attacked and abuse and trying to think of what else, assaulted. So it's absolutely amazing, and it's inspiring. And that's what I want you to take away from this whole incident, is that I want you to rationalize your feelings about this. Rationalize how you feel about it. Work through the emotions that you're going to have if you've never watched the videos of this. But I want you to think about how she has maintained her composure throughout this entire incident. She's never faltered one bit. She's maintained her professionalism. Sure, she probably has sought advice. She's probably sought legal counsel on what words to use and what to say and what to not say, because, quite honestly, she has every right to bring this police officer up on charges, because I'm just going to flat out say it. This can be interpreted as an abuse of power and bullying. This can be interpreted as just flat out bullying, because he had no grounds to arrest her. He had no grounds to use physical force. He had no grounds to subdue her and chase her in the manner in which he did. So if he wasn't a police officer, now it's kind of hard to imagine this scenario without him being a police officer, but that police officer, he borderline assaulted that nurse. And I'm sorry, but how do you not at least think about that? And it's very hard to maintain neutrality, because we're nurses. Most of my fans, most of the tribe out there are in the healthcare profession in some way, or you're nurses, and you're going to stick up for your own. You're going to defend your fellow colleague. But, was this an abuse of power? Was this just a bully who was angry because he didn't get his way? And now I'm throwing out personal opinions here, and I don't want you to think that that's the way you should think about this. Do I think that the police officer assaulted the nurse? I want to give you the politically safe answer, but yeah, I hate to say it. It was flat out a bully throwing his weight around and having the legal right. I don't want to say legal right, but he as an officer of the law, he has the right to arrest you under probable cause. Once again, I don't know the legal lingo. I don't know the law in the way that I should, but it looks like he just assaulted her, because she was in no way, shape, or form threatening his physical harm. She wasn't threatening him physically in any way, shape, or form. She wasn't verbally abusive. She wasn't physically abusive. She wasn't physically demanding. In fact, she wasn't physically aggressive in any way. She was actually very passive. She kept saying sir and being mildly apologetic and being very passive, very professional. And yeah, there's many people in the live feed that are saying that he was completely out of line. And quite honestly, I have a hard time not agreeing with that. I have a hard time not feeling a bit slighted about that, and feeling so bad for Nurse Alex that she had to go through that. But even after going through all that, she's still a shining star, because she's showing her emotion. She's been seen crying on camera during her interviews, but once again, she's not redirecting anything. She's not verbally attacking anybody for anything. She's simply stating the facts. She simply was advocating for her patient, and she simply was doing her job. And she got arrested for it. The problem is, the problem is that I don't think this police officer and this police department, I don't think they have a leg to stand on. Because if you watch all the videos that are out there, once again, I've said this already once, there's no gray area. Alex did nothing wrong. Nurse Alex did nothing that was illegal or that required her to be physically subdued in any way. So, you know what? There are going to be people out there that are going to have a really hard time not siding with Nurse Alex. And a lot of people are asking in the live comments right now what happened to the police officer. So from what I understand, when this finally came out and was in the public eye, the police officer was initially suspended from the blood drawing task force. He wasn't allowed to do any more blood draws, but he was still walking the streets. And then a day later, 48 hours later, less than 48 hours later, when this decided to swell on the internet and explode, the police officer is currently on a paid leave, or he's on a leave of absence, or I'm sorry, administrative leave. He's currently on an administrative leave, and there is an internal affairs investigation. So this ain't over, folks. This ain't even close to being over. And as information comes to light, I'll try and share it on my public pages, as well as I'll share it in the comments here. I will do my best. Once again, I want to thank everybody for hanging out in the live feed. This was probably the most polarizing live video, live streaming broadcast that I've had to date. And for good reason. There's a lot of nurses out there that are just pissed off, and they are supporting their fellow nurse. They are supporting Nurse Alex, and they're advocating for nurses all over the United States. I wish that I could scan and scroll through all of the comments. I really do, gang, but yeah, I hope you can appreciate that the number of people in the live feed here is just astronomical, and I'm blown away. If you have any comments, any other opinions about this incident that we haven't talked about, I would love for you to leave them in the comments. This is, once again, this will be recorded on Facebook Live, but I will share it everywhere for everyone to view. If you want to comment on it somewhere else on the social internets, I'll see what I can do about sharing your comments everywhere else. I want you to take this video and share it with everybody you know. Share this with any human being out there. I don't care what they do, what their occupation is, how old they are, where they live. I don't care. I want you to share this with every human being that has a heartbeat, that is currently existing on this planet we call Earth. I want you to share it with them, because nurses need to be supported, and we need to show the world how difficult it is to advocate for another human being, especially in the face of the resistance that Nurse Alex had to experience. I want to thank everybody one last time. Y'all freaking rock. You know how to find me? If you don't find me on my Facebook fan page, you can find me everywhere on the internet. Just Google SeanDent.com. I'm very hard to miss these days. Not only the bald head, but I do a little bit of everything out there. If you're still hanging out with me, if you're still surviving and watching the end of this video, send me a message. Say hello. How did you find me, and what did you think about this video? Share it with your friends. Give it a thumbs up. And if you happen to check this out where you can hit that subscribe button, I'd love for you to hit the subscribe button. What do I say at the end of every video? My tribe. And as always, check your own pulse first.